This is Level Up Life After 40 with Chey P.
And Amy E., helping women over 40 to grow, reinvent, and stop settling for just getting by.
Because your best chapter might just be ahead. Thanks for tuning into another fantastic episode of Level Up Life After 40 with Chey P and Amy E. And I'm very excited about our guest. We have Dr. Kamala Tamirisa with us. I said your last name right, correct?
You did. Right on.
Awesome. And she is a cardiologist. And so this month we're focused on health and energy. And I think the heart plays a part in both of that. So, and I heard that heart disease is the leading cause of death in women. And so we just kind of wanted to discuss that. She's nodding. Kamala, am I right on that point?
100%. It's something that people don't realize. People, when you ask them, what is the number one killer in women? They say breast cancer. No, breast cancer and cancers are there, but the number one leading cause of death in women in the United States is heart disease. And if you want to know the data, it's 1 in 5 women die over lifetime due to some kind of heart disease. So it's high. And if you look at the number of women living in the United States, right? 60 million, they have some form of cardiovascular disease, and menopause, postmenopause risk goes up, and it's a real issue that is not acknowledged, and there's lack of awareness around surrounding that topic.
Wow. Yeah, it doesn't get all the press that, like you said, like breast cancer and stuff does. That's crazy. That's a
Mhm.
crazy statistic.
I
So
had no idea it was 1 in 5 women.
Yep. Mhm.
that's insane. Well, what exactly encompasses heart disease? Is it like all the diagnoses that you could possibly get for your heart, or is it something specific?
Yeah, so heart disease includes vascular disease too. So the commonest form of heart disease is heart attacks. You all heard about heart attacks. Why do heart attacks happen? Because of narrowing of the blood vessels that bring blood to the heart. And the narrowing happens because of cholesterol buildup or blood clot. And in women, we also tend to have a spasm of those blood vessels. So the blood vessels are not only smaller in caliber, they tend to get blocked because of the cholesterol built up or a clot. On top of it, the blood vessels in women do spasm down. So if you think of it, when it spasms down, the tube that allows the blood to flow, that the surface area or the amount of basically inner diameter is smaller, right? So you're at a higher risk of having a heart attack because the heart muscle does not get enough blood supply during that time, and so the heart muscle suffers injury, and that leads to heart attack. So that's the first form of heart disease. Second one is the stroke. Stroke happens because of the blockage in the arteries that take blood to the brain, and stroke is also part of the cardiovascular disease. And then what leads to these risks? High blood pressure, diabetes, tobacco use. Postmenopausal women tend to have increased risk. And pregnancy itself is a risk factor for heart disease, especially high risk pregnancies are known to have long term negative effects on the cardiovascular outcomes. And high cholesterol, obesity, and lack of exercise. And another thing I'll mention is the stress and the anxiety and lack of sleep. All these contribute to high adrenaline levels and lead to poor dietary habits, and all can contribute to ultimate cardiovascular disease.
So it's really a myriad of a lot of things that are working against us, per se, that gets us to the point of heart disease, which eventually could cause a heart attack and cause us to die. I'm curious about the spasms that you mentioned, because I've never heard that before. So when you talk about a spasm, is that women's blood vessels tend to get small, or they're just smaller in nature, or something happens in our lives where it causes them to spasm or tighten up?
Yeah, and no, I think they tighten up, tighten up. So you remember, women, we tend to have, in general, smaller caliber blood vessels in diameter when compared to men.
Hmm.
And on top of it, the second point that you just mentioned, Amy, which is the tightening up or just closing down, that's the spasm of the blood vessel. It shuts down for a few seconds, and then, obviously, during that brief few seconds, the heart muscle does not get enough blood supply. And of course, the patient will have a heart attack. There is a special term for that. We use a medical term called the vasospastic angina. Angina is chest pain. Angina is chest pain. Vaso is a blood vessel. Spastic is just spasming down. So vasospastic angina. So women, they go to their doctors and they say, I'm having chest pain. I've been having these episodic chest pain. During that time, I feel short of breath or I just don't feel right. And comes and goes. And most of the time, the standard procedure that we do is inject contrast in the blood vessels to take a look for a blockage. But if it's a vasospastic angina, the blood vessels are clean,
Can't
right?
see it.
There's no blockage. So the physicians come out and tell these women, well, there's no blockage in your heart arteries. But the woman goes, no, but I have symptoms. So it's very common, it's more commoner in women than in men. And we think, this role for hormones, maybe it's not well understood, but also the depression, the anxiety, and the stress, these also contribute to that, you know.
Well,
So I wanted to throw that little data out there.
mhm,
You said the word stress, which, as as we all know, as women, we are under a lot of stress
Mhm.
between career, managing
Yes.
kids, managing a household, taking care of
Mhm.
elderly parents or family members. I mean, the weight of the world falls on our shoulders sometimes. We keep taking it in and taking it in, and at one point, I guess we reach a tipping point where our
mhm,
body is telling us, no, you need to make a change. And it does so with these artery spasms.
mhm.
Mhm. No, well said. Yes.
Women constantly get the message that you can have it all, so we feel like we have to aspire to that, and I think we almost overstress ourselves when maybe we're trying to go after things that we may not necessarily want. I don't know, that
Mhm.
could just be my opinion, but, um, so that's kinda scary, and is there any way to prevent those vasoconstrictions that happen randomly? Or is that just because we're women, we're gonna get them?
We are women and we're going to get them, but then reducing that stress and, getting adequate sleep, sometimes is uh, no obvious reason, just because of being women, we just tend to have it. I just wanted to take a little bit of step back. Another point I wanted to make is not only the disease spectrum is different in women, but then also when you use the term, how do we prevent it? Something sparked in my mind I wanted to touch on is how do you help these women detect the symptoms in a timely manner? The interesting thing is women just don't have as many typical symptoms like men do. The commonest symptom with a heart attack is a crushing chest pain, right? We tell people it's like a fist, or an elephant sitting on your chest. And that crushing chest pain is a classic symptom of heart attack, and that's very common in men. But when it comes to women, symptoms are just this unusual fatigue. They just say, "Oh, I'm tired over the last few days. I want to do more, but I just can't get myself to do it." And then circling back to what Amy and you said is we push through. We're just known to pushing through things. So that unusually worsening fatigue without any secondary reason behind it. It's not like the loss of sleep or they're coming down with a cold or something. And keeping a high, antenna up to notice that change in the energy levels is one of those symptoms of heart attack in women. Another thing get women patients, they say, my left jaw hurts or my tooth hurts. And they don't have any tooth infection. They just don't have it. But this is just gnawing symptom that just comes for 15 to 20 minutes and then it eases up. During that time, they might say, I'm having nausea. I feel dizzy. I feel a little out of breath. And, they might say, I'm a little lightheaded. And then it goes away. So by the time they seek help to go to the emergency room or mention these symptoms to, their doctors, there's a delay because
You feel
I
fine.
mean, yeah, yeah. How many
Back
of
to
times,
normal.
yeah, this is normal. It comes and goes. So, I think where the prevention comes is awareness, educating all of us. Women need to know that they might have atypical or not usual symptoms, very unusual symptoms, and making sure not to ignore those and seek help right away.
Hmm.
I had no idea. I always assumed that everybody had that, like you said, that elephant sitting on your chest feeling. And then that's your classic telltale sign that you're about to or having a heart attack. But I had no idea that these almost subtle, I don't have
Mhm.
as much energy as I used to have, or God, why is gardening so much harder today? Or I
Mhm.
used to be able to do a 5K like it was no problem. And now I can barely walk 3 blocks without
Mhm.
being out of
Mhm.
breath.
Yes, yes, that's exactly right. That's exactly right. Yeah, I know I brought the menopause as a factor. The average age where there's a blockage in the arteries, having a classic heart attack due to the blocked arteries, and those usually tends to be postmenopausal around maybe 55, goes up until 70s, older age too. But that's important to know that postmenopausal women, there is an increasing risk of heart attacks. But more and more, just like in men, we've been seeing younger women between 30 and 50 years come too. So keeping an eye on those. And, one of the areas I've done quite a bit of research and my passion is pregnancy induced and post pregnancy heart disease. And there's data there that if a woman goes through a complicated pregnancy. What do I mean by complicated pregnancy? It could be pregnancy induced high hypertension, high blood pressure during pregnancy, pregnancy induced diabetes, gestational diabetes, or preeclampsia, eclampsia. These are, or even preterm birth, these actually become unique long-term risk factors over time and contribute to higher risk of heart attacks. So women need to know that it's a continuum after delivering the child, and it's not like it's one-time deal. I usually tell people you need to go and see a cardiologist. You need to focus on prevention and then be on top of reducing the risk factors.
Wow. So,
Is that something that the OBGYN tells these patients?
It's a very good point, Amy. So more and more medicine, especially in the care of women and heart disease, is moving into collaborative models. So even though I'm a cardiac electrophysiologist or cardiologist by occupation, I work very closely with the maternal fetal medicine and high risk OBs, and so it's a team. They deliver the baby, they take care of the pregnant mother. I come on board to help manage the risk factors for heart disease after the delivery. Then I make sure to, focus on whether it's abnormal heart rhythm or, prevention over lifetime.
That's amazing. Why do you think it is? You mentioned earlier that younger women are starting to show signs of early heart disease. Is that diet, lifestyle, genetics? What are some of those contributing factors, do you think?
I think all of those that you touched on, more and more we see, the risk factors, the lifestyle choices. I feel like tobacco use has gone down, but then we also do vaping or something, just nicotine products in any form cannot be healthy, right? And then not only that, the obesity trends are there. And the diet, I don't know the effect of diet. I mean, the studies have shown us that healthy diet is good. Mediterranean diet, rich in vegetables and fruits, organic diets. But then when you look at artificial colors that we add to diet and just uh, processed foods, they over time, I cannot imagine that they are healthy in the long run for anyone. You know,
Mhm.
even independent of the heart disease, I worry for cancer risk and these things. They cannot be healthy. So yeah, and then, to add to that, I feel like this era we live in, right? Everything is social media, the daily stressors. No more are we disconnected, and I don't know how much time people are taking time to sleep, take care of themselves, daily stress, and taking on more and more stressors upon themselves. Just like Cheyenne, you were mentioning, right? So I think it's a cumulative effect of all these.
Mhm.
I love that you brought up the social media part because you're right. We're always on. Remember
Hmm.
when we were
Hmm.
younger growing up, it was like you ate dinner and then you sat down as a family and you watched TV and you had that what we called the downtime. You just
Yes.
had this moment to like decompress and just
Yes.
relax. And
Hmm.
now, yeah, we might be sitting in front of the TV, but we're checking our phones every two
Phones.
minutes to see who's posted the latest story. And then all the reels that we follow and all the sites that it's like our brains are constantly
Mhm.
adding all this unnecessary, like you said, stress to our lives where we're never getting that chance to fully rest and get that 8 hours of sleep. But I'm kind of believing that our bodies probably need a couple more hours of downtime before that to get into the place where we can have a
Mhm.
solid 8 hours of restful sleep. So I'm so glad you brought that up because you're right. It makes sense why women at a younger age are experiencing these early symptoms that
Mhm.
Hmm. Hmm.
20, 30, 40 years ago weren't happening.
Yep.
Yeah, yeah, absolutely. If I may, I'll add one more point to the same things that we discussed, right? More and more, we also are seeing advanced maternal age. So women are older by the time they're getting pregnant too. So, that advanced maternal age is one of the risk factors as well.
Mm.
So that trend is more, seen more lately than what it used to be 20 years ago, 30 years ago.
Yeah,
Mhm,
that's true. I'm just gonna ask a quick question here, because
Mhm.
everyone knows that I've had a little bit of a love affair with energy drinks. Okay. If you're not watching the video, I just got eyeballs. It's 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 getting better. It's getting better,
mhm.
but it's a struggle, and part of it is because I think, like, my body starts to crave the artificial sweetener, but also I like, and this is terrible to say, but it makes my brain feel good. But I know I promise you, I notice, like, "Oh, I need to take a little break because I've sent Amy texts, like, "I'm having a bad heart day today because I have AFib, I had ablation done,
Uh-huh.
I'm overweight." I mean, like, I have a lot of the risk factors that you're talking about, so I'm very aware, but sometimes I think unless we actually feel it or see it, we don't do anything about it. I can't see my heart, I can't see my blood vessels, so I don't know that they're scrunching around, causing blood to not flow. But anyway, my original point. Let's talk about energy drinks and if you want to throw in caffeine just in general, if you have knowledge about that as well.
Yeah. You already said, I did not know you had AFib and you had an ablation. Huh?
Mhm.
Okay.
Yep.
Uh, well, AFib is what I deal with. I do ablations, and atrial fibrillation is one of the diseases I actually treat. And, focusing on the atrial fibrillation and also heart disease that we've been talking about, right? Um, what happens when we have energy drinks is the tachycardia, rapid heart rates. So here we are putting the heart under stress, increasing the heart rate, and basically being women and everything else we talked about, smaller blood vessels, the other risk factors. So it doesn't take much for the heart to be put under stress. And AFib is one of the risks with energy drinks because of the stimulants. Not only AFib, but we also know AFib in women, the combination increases the risk of stroke. So being a woman in itself is an independent modifier for stroke risk. For everything else, you add that to hypertension, diabetes, and and then you bring in AFib because of the energy drinks and the stimulants, etc. Alcohol is a stimulant, and that has been shown to increase the atrial fibrillation burden.
Mm,
And so, combination of these, we put ourselves at a higher risk for stroke.
wow.
And that's cardiovascular disease. So, very
Right.
important. You mentioned about caffeine. A very interesting thing with caffeine is data goes back and forth lately as far as atrial fibrillation goes, because they were taking that one type of heart disease. Caffeine has not shown to increase the AFib risk.
Okay.
So one message I have for my patients is, apart from walking daily and exercise and healthy diet, I do tell them if you're using stimulants and energy drinks, I would urge you to stop that. And the second thing I do tell them, please stay away from alcohol. Alcohol over time has shown us that it can cause more damage than we want to accept because it's something, it's fun and it relaxes. So I
Mhm.
tell them, do it, do it, and just very sparingly, use it very sparingly if you need to use it.
Since you brought up alcohol, I want to ask about red wine because for years we
Mhm.
heard like red wine, you should drink it because of the res, res, say the word starts with an R, resveratrol or something. Um,
Mhm. Mhm.
so
I know, no. The data went back and forth, and as of now, you talk to 10 cardiologists, half will say, yeah, it might have some benefit in reducing your cholesterol levels and might have a benefit. But I think most would agree now that alcohol not only causes atrial fibrillation, which we talked about, because it leads to scar in the left atrium. So the left top
oh,
chamber of the heart, alcohol hearts, they have a large amount of scar, causes scar, kills the muscle cells, and that's what alcohol does. Second thing we know from excessive alcohol intake is it causes the heart pumping function of the heart to go down. So there is an entity called alcoholic cardiomyopathy, which is alcohol induced heart failure due to a weakened heart pump. When we see people who are dependent on alcohol, it's kind of sad. It's a habit that is such a preventable cause, right? Unlike the genetics, you can't alter the genetics, you can't alter anything in the genes. But at least if alcohol, tobacco, these we can modify and avoid to
mhm,
keep the heart healthy.
okay. So if I get off the energy drinks and I drink like a glass of tea, I live in the South, man. We have our sweet tea and I can use some monk fruit. I'm fine with that, but that would be okay. Like if I were to switch to
Yes,
that. Now, Amy's
100%.
screwed because Amy enjoys her wine
I do
nightly.
enjoy my wine, doctor. I'm sorry. And I try to tell myself that I can justify it because I always have a glass of water with every glass of wine that I have. So I
Mhm.
keep my 1-to-1 ratio. But, to be honest with you, I had no idea about the weakening of the muscle in the heart. When people talk about people that are alcoholics or that die of alcoholism, the first thing you hear is renal and kidney failure,
Hmm.
Yes.
right? But you don't hear also the heart part of it, and I had no idea.
Mm-mm. No,
Yeah.
I didn't either. Is
Yeah.
I'm wondering, and now is that the call? Like when people say they died of alcoholism, is it typically because their heart just gave up on them? Or is it like a combination of all the organs, like, dude, you're killing me kind of thing?
Shutting down.
Combination of all the organs, and actually alcohol causes the liver to go bad, liver cirrhosis. I see cardiomyopathy, which is a weakened heart pump due to alcohol at a
Wow.
higher rates.
Okay. Let's thankfully that's one thing I don't really engage in. So I have one risk factor has been mitigated. Thank you. Now
Don't
I
worry,
do
Cheyenne, I took care of it for both of us. We're
yes.
good.
Now, but Amy works out like all the time, lifts weights, all the things, which we'll touch on in a minute. But I do have another question because you brought up
Mhm,
sleep. Um,
mhm,
I do have sleep apnea.
mm,
I do know because I used to worry about it. Oh, is it because I've put on weight, which I know your weight can affect it, but I do know people
mhm.
that are thinner and fitter that have sleep apnea. I did not realize that sleep apnea could also lead to atrial fibrillation and stroke and stuff like that. So when we talk about sleep, and I don't know if you know this stat, but how many women have sleep apnea and maybe are not diagnosed or don't recognize, and that could be even leading to some of the fatigue they experience, and they just chalk it up to menopause because it's like we're supposed to be tired, our hormones are changing.
Mhm, mhm. I'm not too sure about like data among women, but sleep apnea is yeah, it's there. You know, a lot of my patients with atrial fibrillation have sleep apnea, and to your point, sleep apnea could be due to the weight itself, or sometimes, despite normal BMI, some patients have sleep apnea. So having that awareness, and I usually ask the spouse or the partner, hey, does it, your spouse or your partner, do they snore a lot? And then they pause
Mm,
for a
mm,
long time and they say, yeah.
mhm.
And then I see AFib too. Then I say, you should get a sleep study done. And do we have data to show that sleep study and management with the sleep apnea basically reduces all the risk factors that could contribute to heart attacks or even AFib? Not 100%, but what does sleep apnea treatment help with is exactly what you touched on, quality of life. People are more awake during daytime, which means that they will work out and do more exercise, and exercise is mitigating the risk factors and helping whether men or women reduce their risk for heart attacks and heart disease in general.
My next thing is because I know you mentioned like some diagnostics are not going to show when women are having heart events, but annually, if you're going to the doctor as you should, what diagnostics should people get regularly and what would be a red flag?
Mhm. Great question. So, number one, the diagnostics include knowing your body. Okay, just like everything we covered. Know your symptoms, know your body. What's your normal? Did anything change? And seek help right away. Do not delay. Put yourself along, just like you put your children, your spouses, your everyone else first. That's number one. Number two, when these women seek help, from the physician standpoint, then there's data here. There's data showing that, male physicians sometimes blow it off, saying it's anxiety. You're having anxiety. It's not a real thing until they show up with a massive heart attack. So even for us as physicians, we need to treat women the same way, do the workup just like we treat our male patients because their symptoms, if any, we need to be aware that they might have atypical or not the typical symptoms. That's one. Now, when they go for the basic tests we do, apart from checking the blood pressure and all those, are the getting an EKG done. That shows us the electrical signals, how that looks. If there is a change when compared to the year before, then that gives us an indirect indicator. And then getting the cholesterol level checked, hemoglobin A1C checked because of borderline diabetes, and then, if they're having any symptoms, a good idea to get an ultrasound of the heart, which is the echocardiogram. What does that show? It shows us the function of the valves, size of the chambers of the heart, and also the pumping function or the ejection fraction of the heart.
Mhm.
And being proactive and asking physicians. I'm postmenopausal. I've been having a little bit of symptoms. I'm a little worried. Could you do an echocardiogram? Asking those. And then if someone is having palpitations and have sleep apnea and they're worried about AFib, wearing an external monitor to detect that. The monitors could be worn for 30 days or 2 weeks, depending upon how frequently those symptoms are happening. Then we do stress tests. Stress tests are done and they can be done with an exercise. But in women, the stress tests again can be false negative at a higher rate. So that's the problem. So you definitely, that's a starting point to get that. But if you're continuing to have symptoms and the physician and the patient have a discussion and you're like, I just don't feel right. This is not me. Something is going on. Your EKG, the echo, and even the stress test is okay. It's okay to ask and say, could you do a coronary CT angiogram? So it's a CAT scan, special CAT scan for the heart. It's called a coronary CT angiogram. So this one is very similar where we inject like a contrast by entering the blood vessel through the wrist or the femoral vein in the upper thigh, but it's not invasive. So this one is very similar to that, but without being invasive. So it's a CAT scan specifically for the heart. What does it show? It shows the blood vessels, how thick they are, how if there is a narrowing, where is the narrowing, what is the degree of narrowing. Let's say someone gets that and there's narrowing, then the cardiologist usually says, I see a disease, there's some narrowing there. It's a bit more, 60 or 70 or 80%. I want to do a heart catheterization or cardiac catheterization. That is a diagnostic test where we go through the wrist, through the radial artery, or through the upper thigh, through the femoral artery, and inject contrast. It's just like roto-rooter. It's like the plumber's job. You inject the dye,
Right.
dye, and then you'll take a look if there's a blockage. If there is a blockage, then the treatment would be to get a stent. A stent is a metal tube that's placed to keep the blood vessel open by pushing the clot closer to the walls and opening the lumen so the heart muscle starts to get the blood supply again. The other side is what you were talking about is the ablation. That's not dealing with heart attacks, but with the atrial fibrillation, which is also a heart disease, form of heart disease. We do ablation procedures where we go through the vein, enter the heart, and basically cauterize the short circuits that are causing AFib. And there's a brand new technology called a pulsed field ablation, which is extremely safe, much safer than what we used to do. So plenty of solutions out there. So starting with the patient, physician's bias needs to be overcome. Then being proactive, asking for those tests is important.
Nice.
My question, real quick, is what age should women get these first round of diagnostic tests? What age do you recommend?
There is nothing like that. I mean, if someone has a significant family history of premature heart disease, if someone walks into the office and says, "Yeah, mom died at the age of 49 from heart attack," and then a maternal uncle or a first cousin, and then the cholesterol levels are high, like total cholesterol up more than 200, 250, 220, and they also have diabetes, hypertension. Now you're looking at a higher risk. And there is something called a Framingham risk score. So people can type in Google and say Framingham risk score. And what is my Framingham risk score? And if you put in your data points there, it asks for age, hypertension, diabetes, cholesterol levels, and it gives you if you belong to the low risk group, medium risk group, or the high risk group. Obviously, the high risk group will need testing right away. The medium risk group, again, some testing and also lifestyle changes, and then being aggressive with whatever those risk factors are. And the low risk group probably wouldn't need any testing done. These would be those patients who run marathons and they're fine and they're asymptomatic. I would caution against over testing, because sometimes when you over test, then you're going to find something abnormal. I joke with my patients that incidental finding, if it gets to the mind and stresses them, that's going to kill them sooner than the heart attack itself. So I tell them, don't worry about it. Just don't,
Mm, that's good
Yeah.
advice.
Mhm,
Okay. So as far
mhm.
as prevention, because we've talked about diet and exercise, and I will ask you a little bit more specific questions, but for you, oh, because I'm more with homeopathy, I prefer to try to solve something in a natural way than try to take a medicine. So, what do you feel about some of the supplements that they say are good for you? Your vitamin D or your fish oils and
Mhm,
garlic
mhm.
pills, stuff like that. What are your thoughts?
Fish oil has shown benefit, and vitamin D is very healthy. Those vitamins are good and they're healthy. If we get into herbal supplements beyond that, we just don't have definitive data. We just don't have a large scale data. And sometimes I do tell my women patients, if they're having palpitations, they're postmenopausal, perimenopausal, and they're taking acid reflux pills, which comes with the menopause. I tell them, yeah, take a little bit of magnesium supplement. That's one thing I do mention to them, because of low magnesium levels that come with using acid reflux prevention management. But other herbal supplements, patients do come, they ask me, and I tell them, I, just because I'm a physician, I just don't know everything. I want to have the humility to say, I just don't know
Mhm.
enough in that area.
Okay. Okay. And then my last thing, because you mentioned walking,
Mhm.
and which I know is good for you for many reasons.
And American Heart Association has the exercise guidelines, 75 minutes or 150 if it's a moderate exercise. To simplify our lives, I tell patients 30 minutes a day. That's all I'm going to ask. 30 minutes a day, walk or slow jog. Please do that. I tell them 30 minutes, tell everyone chill. Kids, the spouse, and everyone can wait. You just go out, enjoy the nature. And if you want to listen to an audiobook or a music, whatever. And or if you have a neighbor who wants to do the same thing, go out 30 minutes a day is 100% doable. And some do tell me, life is super busy. Then I tell them 15 minutes in the morning, 15 minutes in the evening. If you can fit that in, that would be great. But then when you walk, try to have a brisk walk. Start
Mm,
off slow, build it up, and have a brisk walk. And then, um, if there are no joint issues, no spine issues, and the body can handle it, I really think the flexibility and yoga, I'm using yoga as a, Pilates, yoga, whichever. Flexibility is also very important. I'm not saying from cardiovascular benefit, but it just loosens those joints. So arthritis is delayed, mobility is better, which means you'll exercise more, you walk more, and in turn, indirectly, it reduces the risk. So even 15 to 20 minutes of adding that, whether you want to just sit at 8 pounds, 10 pounds, 5 pounds of weight, just stretch, tone those muscles, core exercises before the postmenopausal arthritis sets in and everything becomes slower. Planting those small seeds with that much activity is good enough.
okay. Great.
And stretching is something that you can do while watching TV,
Exactly.
right?
Exactly.
Yep.
Yeah, no, no, it's great. That's a great idea. Each on ourselves. Start in small 15-minute time slots, increase it to 30 minutes, and then add as you go.
Mhm.
It's
You talked about, like, people not having time. Whenever somebody says something like that, I will just say, "Well, you're gonna lose more time if you end up in the hospital, or if your family
Yes.
can't do without you for 30 minutes, how are they gonna do if you're gone forever?" Which I know is morbid, and I'm going to the worst case scenario, but from what you've said, there is the possibility of a worst case scenario. Or
Mm.
if you have a stroke, your whole quality of life changes. I worked in healthcare. That is
Mhm.
terrifying. In fact, here's too much information. When I had my ablation surgery because I knew I was risk for stroke, I just told them, like, if you can tell that I stroke out on the table, do not bring me back. Just don't.
Mm.
I don't want to have to deal with that. I don't want Brett to have to deal with that because you never know the severity of it.
Yes.
So, yeah,
Yeah.
I'm
Very
straight up a
much.
DNR girl. Like, if the Lord calls me home, that's where I'm going because he clearly wanted me there. He's ready for a good time. But
Believe it or not, I am a DNR too. I'm like, nope,
but
no, the time comes, I gotta go. You're not putting me
Mhm.
on any machines.
thank you
I
so
want to,
much.
yeah. So we are all similar. Yes.
Yep. So, anyway, but I
Thank
thank
you both.
you.
Yes.
Yeah, appreciate your time. Thank you for imparting such good knowledge. I really loved it. So, take care of your heart and
Bye.
remember,
Bye bye.
you got this.
Just a quick reminder, everything we share on this podcast is for inspirational, personal growth, and real-life conversation. We're not doctors, therapists, financial advisors, or legal experts. Just two women sharing experiences, lessons, and stories to help you level up your life. Always do what's best for you and seek out qualified professionals when you need specific guidance. Take what resonates, leave what doesn't, and remember, you got this.